Hi, everybody. Dr. McPartland. I'm live with, no, I'm not live. You're watching this on tape. I'm with you on Zoom. And today we're going to be talking about some of the legal concepts that we've had in class from some of your assignments and a little bit of the feedback that I got. Some of you want some additional clarity on some of these issues. So here I am, and let's get ready to roll on this. I'm going to share my screen, and then we'll get going. Won't be that long. If the quality doesn't look that good, it's probably not your computer. I have a new laptop. Not thrilled with the camera, but what can you do? Almost there, almost there, almost there. Okay, let's get going. So a few legal concepts. We're going to look at things from a healthcare perspective, and we're going to talk about them very, very generally. By the way, as you probably know, you can pause the video at any time. You can replay it. You can make fun of it by sharing it on social media, wherever you want. And the main topics for today will be assault and battery, and negligence and malpractice. So assault and battery, we hear these words a lot on TV and people use the terms in everyday conversation. The legal aspect of assault and battery is different from what we might see on a police show or a law show or people just talking on the street. You shouldn't talk on the street, you should move it to the sidewalk because you might get hit by a car driven by a negligent driver. That's free advice. Okay, start with battery first. What is battery? Battery could be defined as the harmful or offensive touching of another person without their consent. Harmful or offensive touching of another person without their consent. So, what's not battery? If you tap someone on the shoulder, say, what time is it? Probably not battery because can't see the harm in that. If two boxers get into the ring or two mixed martial artists get into the ring, they're harmfully and offensively touching one another, but by them signing up for the fight, they consented to it. So if you push someone down a flight of stairs, clearly battery. Do you actually have to touch the person? No. You could take a sledgehammer and hit someone in the head with it, and your defense, well, I didn't touch them, probably won't go too far. One thing I want to point out, that assault and battery can be used in the criminal context, meaning you can be brought up on charges. Who files charges? Not the individual that was hit, but the state of Florida, the United States of America. The government brings criminal charges. Assault and battery also exists in the civil context. Criminal law, civil law. In criminal law, it's the government versus whatever. Way back in the day before you were born, it was the United States of America versus O.J. Simpson, famous legal case. But in a civil case, a lawsuit where you sue someone in court for money, it's person A versus person B. So battery, the harmful or offensive touching of another person, very importantly, without their consent. Otherwise, every surgery would be battery, but people consent to surgery. However, if someone does not consent to surgery, could they sue the surgeon, the hospital, for battery? Probably. If it was a life-saving surgery and they just didn't get the consent form signed, good luck with the jury. Assault. Assault could be defined as the threat of bodily harm coupled with an apparent present ability to cause the harm. Another way of putting it is assault is putting someone in imminent fear of battery. Imminent, I mean immediately, right away. If someone's in California, they call you up in Florida and say, I'm going to punch you in the nose, it's not assault because there's not that imminent or immediate or just about to happen real threat of bodily harm. But Assault can accompany battery, or it could happen on its own. For example, if I take my fist and I pull back and I go, where's the camera? Go right for your nose, but I stop short, I've assaulted you. I haven't battered you because there was no touching, either by myself or another object. Did I put you in imminent fear of battery? Yes, I did. Yes, I did. And if I went through and actually hit you, I guess that's a good close-up of my fist. If I actually hit you and I put you in the fear of battery, that's assault. And if I actually punched you, that would be battery as well. So they could go together. They could not go together. For example, how do you batter someone without putting them in the immediate fear of battery? Well, sucker punch someone. They never saw it coming. So if you come up to someone from behind and punch them in the back of the head, you've battered them for sure. But you haven't assaulted them because they spent no time, not even a millisecond, in that battery because they never saw it coming. They never perceived it coming. If someone throws a knife at you and it misses you by that much, they have assaulted you. They haven't battered you, though, because there was no touching either through the person, him or herself. I'm going to make it a him because it's mainly women in the group. So we'll make the bad guys men, bad guys guys. And I lost my train of thought. In any event, you can have assault by itself, battery by itself. Very, very often you have them together. Assault and or battery can be criminal charges. You get arrested by the police and the government brings you up on charges. It could be civil, meaning the person who got assaulted or the person who got battered could bring a suit, going to court, looking for money, and it could be both. The same action could give criminal liability to someone as well as civil liability, meaning they could be sued for the damages that they caused. Negligence and malpractice. We're almost done, although this is a little bit longer. Negligence and malpractice. Keep in mind, in a real general sense, negligence and malpractice are the same thing. People out there on the street kind of think it's different. I'm going to sue that doctor for negligence, and then when I'm done, I'm going to sue him for malpractice, and I'm going to sue him for every penny he has. Well, not really. Before we define negligence, just keep in mind with malpractice, malpractice is negligence happening in a professional setting. So a dermatologist is driving his car down the road, doesn't stop actually, looks down to check text messages and hits a pedestrian with his car. That's negligence. It's a dermatologist, a doctor. Is it malpractice? No, because this was not done in the professional setting. What makes negligence and what makes up malpractice are really the same thing. There's 4 parts of it, and we'll get to that later. But if it happens in a professional setting, it's malpractice. So there could be medical malpractice, nursing malpractice, malpractice for surgical technicians, malpractice for accountants, malpractice for funeral directors. But it means things they did in their professional setting, not in their everyday life. It's really as simple as that, the difference. So what's negligence? There's 4 parts to making up a negligence suit. First of all, negligence, typically, you'll find exceptions, and I'm speaking in generalities. Negligence is typically a civil offense, meaning lawsuit, not jail. Can negligence be so bad that it's criminally negligent? Yes, it can. That's an exception. We'll talk about rules more than exception. So there's 4 elements of negligence. Since I said negligence is civil, not criminal. It is a lawsuit, not an arrest and a conviction and that sort of thing. So the first element of negligence is duty. Second one is breach. Third one is causation. And the fourth one is damages. And to be successful in bringing a lawsuit for negligence or malpractice, you need to meet all four parts of these. All four elements must be met: duty, breach, causation, damages. What are they? Let's talk about it. Actually, I'll talk, you listen, right? Duty. Duty is the obligation that society and the law places on us not to be careless and not to harm others by our carelessness. So duty is an obligation. Some texts will define it as duty means owing a duty of care, taking care in what you do, not being negligent, not being careless. Keep in mind, negligence and malpractice or carelessness. Could be negligence in, let's say you own a store and you don't mop up a spill and someone slips. That's carelessness. Malpractice, medical mistakes, carelessness. It's unintentional. Negligence is not intentional. It is unintentional. It's carelessness, but it's more than that. Four elements: duty, breach, causation, damages. Some texts will define duty as owing a duty of care. I don't like that so much because you shouldn't use the word you're defining in your definition of it. So I like to think of duty as the obligation that society and the law places on us not to be careless and not to harm others by our carelessness. Major portion of duty depends on relationships. And relationships are hard. If you've ever watched Dr. Phil, he says that a lot. I don't watch Dr. Phil. Sometimes if I'm getting my tires changed and it's on the TV in the waiting room, I'll watch Dr. Phil, but I threw that in there. Common law versus statutory law. I'm just throwing that in at no extra charge to you, by the way. Where can I look up what my obligation is? You know, when I'm driving down the street, when I'm someone's house, when I'm practicing as a medical assistant, whatever, you don't find that there. It's common law. What's common law? It's law made by judges and courts. Statutory law is when the legislature, could be the federal legislature, meaning the House of Representatives and the Senate, pass a bill and the executive signs it. So on the federal sense, a federal statute means Congress passes a law. By that, the House of Representatives and the Senate, combined, they're called Congress, and the president signs it. On a state level, the state Senate and the state House of Representatives pass a bill, the governor signs it. That's statutory law. Most criminal offenses are statutory. So where do we find out about civil law? It's common law. You can't really look it up in a book of statutes, a book of laws. It's evolved over time. It started in England before we got our independence and came over. So that's common law. That was a question. Common law doesn't mean it's found commonly or it's all over the place. It means that it's not a written, what they call black letter law, black ink on white paper that you can look at and say, aha, here's the law on negligence. You'll have the law on shoplifting that way because it's statutory. You'll have the law on driving under the influence because it's statutory. But a lot of these civil things are common law, meaning it's been passed down through the years, through the generations by judges and courts. Okay, so a lot of duty depends on relationships. I'll give you some examples. If a dermatologist, I don't know why I'm picking on dermatologists today, but if a dermatologist in his neighborhood, he's out walking his dog and he sees his neighbor walking in the other direction and he waves hello to him. And as he passes, he says to himself, wow, that guy has a bad melanoma on his cheek, and he keeps on walking. Does that dermatologist owe a duty of care? Well, it depends on the relationship. I would say no, the dermatologist does not, because there's not the doctor-patient relationship going on. If he were to see that same neighbor in his office and didn't act on that malignant melanoma, different story, different story. If I'm sitting at home at night watching the Yankee game, as I love to do, especially when they're winning, do I owe a duty of care? Do I have a special obligation to the people on I-95? I do not. If I'm driving on I-95, do I have an obligation to drive safely and carefully with regard to the other vehicles there? Or should there be any pedestrians, bicyclists, whatever? Yes, I do, because it depends on the relationship. So once you engage in an activity, whether there's a duty or not depends on the relationship. Another example, I'll go back to one I used a little bit earlier. If I own a store and there's a spill on aisle 4, and I don't do anything about it, I don't put up wet floor signs, I don't call one of the maintenance people to come over and mop it up, someone slips and falls. As the store owner, do I have a duty to keep the floor free from hazards like that? I certainly do. If I'm another shop, mere presence in the area, does that impose upon me a duty or an obligation for other people? Legally? No. Morally? Maybe. One more example. I'm walking by a retention pond and I see a 14-year-old girl drowning there, and I walk by and I wave to her, just like the dermatologist did to the neighbor. Can I keep walking by and remain free from a lawsuit? Yeah, I can. Morally, different issue. We're not talking morals right now. We're talking legal. However, if that was my child, different story, because I do have a duty to keep my child safe. The law imposes a duty on parents to keep their children safe. Okay? So that's the first element, duty. Has a lot to do with relationships. Breach. Simply define, breach means not living up to your duty or your obligation. Sometimes you might have heard breach of contract. Same word, different context. Breach of contract means you don't live up to your obligations based on a contract that you signed. Breach means you've breached your duty to conduct yourself in a careful manner using reasonable care, or they call it due care, to not create a hazardous situation that injures other people. So breach is not living up to your duty. Few ways you can do this. You can breach your duty by doing something you shouldn't be doing. Running a red light, inadvertently, accidentally, not thinking about it. Or you can be doing the right thing in the wrong way. Give you an example. Patient comes to the hospital to have his right leg amputated. So the patient signs a consent for a right leg amputation. Surgeon has permission to do it, but if the surgeon amputates the left leg, he's really kind of doing the right thing in the wrong way. So doing something you should not be doing or doing something you should be doing in the wrong way, that's how you can breach in the terms of negligence or malpractice. Those are called acts of commission because you actually committed, not in terms of a crime, but you did something. Either something you shouldn't be doing or you did the right thing in the wrong way. Giving the wrong medication to a patient actually is doing the right thing in the wrong way. You can also breach your duty by failing to do something that you should be. That is an act of omission. Commission, you did something when you should not have been doing it or you did it in the wrong way. An act of omission is not acting when action is required. So In negligence, the shop owner didn't spill that tomato juice that people slipped on, but he failed to put up those signs. A radiologist reading a mammogram didn't give the patient cancer, but if he or she fails to detect an early cancer on that mammogram, and a year, 2 years go by, and the patient went from having a very curable disease to one that's incurable, that's an act of omission. Either way, breach is the second element or second aspect of malpractice. Duty, we're up to causation. Causation, really simple. Did one thing make another happen? Okay. And there's all sorts of things, you know, in our lives. Someone makes you laugh. Did he or she cause the milk to spurt out of your nose? Probably, right? I don't know. You could sue anyone for that. But did one thing make another happen? That's causation. Don't like to use the word being defined in a definition, but I will here. Did one thing cause another? The legal test for causation is but for. And here's what I mean. But for the truck driver falling asleep at the wheel, that boy never would have been run over by the truck and become seriously injured. But for test for causation. If the first thing didn't happen, then the second thing would not have happened. But for. And there's more to it than that, and we'll get into it a little bit. I don't think I put it on the PowerPoints, but I'll talk about it a little bit. So duty has to do with the relationship, and it has to do with your obligations that society and the law places on you. Breach simply means whatever those obligations were, one way or the other, you didn't live up to it. You breached your duty. Causation, did your action make something else happen? And believe me, if it's a lawsuit for negligence, we're not talking about something good. Or did your failure to act cause something to happen? So that's duty, breach, and causation. Causation is but for. And I think that's fairly clear. I hope it is. Damages, duty, breach, causation, and damages. In order to win a negligence suit or a malpractice lawsuit, the plaintiff, and the plaintiff is the person who's been injured and is bringing the lawsuit, has to show actual damages, has to show that he or she was actually damaged by the carelessness. Then again, remember, we're not talking intentional, we're talking carelessness. By the carelessness of the defendant, and the defendant is the person or organization being sued. Let me just answer a text. I'm going to pause for a second. Don't go anywhere. Oh, I don't think I paused. I think I just stopped sharing. All right. So you saw me check a text. Are we going again? Aye. Okay, I think we're running. So you need actual damages. So a close call doesn't fit the bill. It's like almost winning the lottery. If that semi truck comes this close from hitting you and you want to sue for negligence, well, you might win on duty, breach, causation, I don't know, damages, definitely not, because you weren't actually damaged, okay? When you have a negligence case or a malpractice suit, what do they mean by damages? Well, you go to court. If You break your hip as a result of negligence. The court can't order your hip to be fixed and you to be as good as new. They can't do that. The only thing they can do is offer a verdict of monetary damages, of money. So some common things that juries consider in damages when they get to that point in a negligence suit are the medical costs, future medical care, lost income, right? You've lost work for 3 months, whatever. Future lost income, you're having the lawsuit, but you're still not back to work and you're not expected to work for a year. Impairment of earning capacity. I suffered a head injury and I can't teach at City College anymore. So now I have to be a United States Senator. So if an injury causes you to not be as marketable on the job market, or you can't do certain things in your job or profession, they can consider that again. Pain and suffering. What we know that value or the cost of medical expenses, you present bills to the jury. If there's going to be future medical expenses, you get a doctor to testify. Well, I expect that this person is going to need physical therapy 3 times a week for the next 2 years. It's going to cost this much. Lost income, you show pay stubs. Pain and suffering. What is the value of pain and suffering? No one knows. There's not a formula for it, but juries figure it out every day of the year. So, and then there's also something called loss of consortium. What that means is, let's say the plaintiff, the injured party, the lawsuit is a woman. And she goes through duty breach causation damages, shows all the ways in which she's been damaged economically, the pain and suffering. If she's married, her husband has a lawsuit as well for loss of consortium, meaning he does not have the wife that he had and would have continued to have but for this accident happening that caused the lawsuit. Okay? So loss of consortium, it's a tag on for a married spouse. So if you're about to get divorced, is there a loss of consortium claim? Yes, because you're not divorced until you are. If you're going to get married the next day, do you have a loss of consortium claim? No, you do not, because you were not married at the time. So those are juries look at and courts look at and how they award in negligence cases. Negligence, malpractice, one and the same thing. I just want to go back. I think this is my last slide. Yeah, and I want to go back, actually. I want to go back to causation. Let me give you this hypothetical. A woman goes to her GYN for her yearly exam. The GYN is 45 minutes late. Could be legitimate. Maybe he was delivering a baby, or maybe he went to Starbucks and got into a conversation with some people, but he was 45 minutes late for the appointment. First of all, she's not happy. Okay, here we go. She leaves the GYN office 45 minutes later than she had expected to. And on her way to work, she goes through an intersection. She did nothing wrong, but a truck comes the other way, rams into her car, causes her severe bodily injury. Truck driver negligent for sure. Let's look at the doctor. What is causation? But for. Here's where we go. But for that doctor being late, she never would have been at that intersection at that time. So, do we have causation not only for the truck driver, but for the doctor under the but-for test? We do. So there's another aspect to it, and it's called proximate cause. That is actually a limitation on liability. And here's what proximate cause means if you ever see it, hear about it, read about it. It means but for is established. Now we have to look at something else before we check off causation. Was it reasonably foreseeable? By the doctor being 45 minutes late, was it reasonably foreseeable that his patient would get into a horrific accident with a truck? I would say no. So it has to be reasonably foreseeable. But for has to be established. And for the truck driver, but for the truck driver not paying attention, she never would have been hit. Check. But for the doctor being 45 minutes late, she never would have been at that intersection at that time. Check. Now let's throw in proximate cause, which is a limitation on causation. Was it, truck driver, was it reasonably foreseeable that the truck driver's inattentiveness would cause this accident? Absolutely. Was it reasonably foreseeable that a doctor being late would cause a patient to get into a horrific car accident? I would say no. No lawsuit against the doctor for negligence that would stand. A good one against the truck driver. Let me just throw a few more hypotheticals at you. I am allergic to penicillin. I go to my doctor. My doctor gives me a prescription for amoxicillin, which is a form of penicillin. I take it to the pharmacy. The pharmacy has it on file that I'm penicillin allergic. I take the penicillin, go home, and drop dead. I have a medical malpractice case against the doctor for sure for prescribing me the penicillin. I have a malpractice case against the pharmacist for sure for dispensing the penicillin. No question about it. Okay, what if the pharmacist picks up and doesn't dispense me the penicillin? Was the doctor careless in prescribing that for me? Let's assume that the doctor knew I was pen allergic. Yes, the doctor was careless. Do I have a malpractice suit against the doctor? No, I don't. What harm came to me? It was stopped. Same thing as, let's say I take the prescription, bring it to the pharmacy fills it, I take it home, start putting the tablets in my hand, look at it and say, smell it, oh, this is penicillin, and I don't take it. No malpractice suit against the pharmacist, no malpractice suit against the doctor because I came to no harm. Could there be problems with them in terms of licensure and things? Yes, but in terms of me bringing a lawsuit, don't forget, has to be actual harm. Not that I almost took the medicine and what could have happened or anything like that. Has to be actual harm. Okay. Another scenario, and then I think I'll wrap up because I've tortured you enough. I go to see my doctor, Dr. Vidibumbatz, and I have the worst stomach ache in my life. I walk into Dr. Vidibumbatz's office, and he's reading the sports page because he's a Yankees fan. I'm telling him what's going on. He shrugs a few times. Yeah. Gives me a prescription for some, I don't know, protonics. Right, thinks it's acid indigestion. On my way home, I say, things aren't good. I don't feel right. I stop in and I see another doctor. This doctor examines me, does a complete history of physical, and says, you have acute appendicitis. You have to get to the hospital right now. I go to the hospital through the emergency room. They take out my appendix just in the nick of time. I want to sue Dr. Vidibumbatz for malpractice. Duty, breach, causation, damages. Okay, duty. Did he owe a duty of care to me? Yes. Why? Doctor-patient relationship. Breach. Did he breach or fall short of that? He sure did. He didn't do a proper examination. Doctors, other medical professions don't have to be perfect. They have to conform to some standards, but that standard is not perfection. It's the reasonable person standard. What would a reasonable general practitioner do in this situation? What would a reasonable LPN do in this situation? So on and so forth. So we have duty, breach. Let's go to causation and damages. Let's go right to damages. So what am I looking at here? Here's what I'm saying. I'm suing Dr. Vinny Bombatz for malpractice. I have medical costs, right? I have an ER bill. I have a surgical bill. I have a pathology bill. I have an anesthesiologist bill. Future medical care, I have 3 follow-up visits. Lost income, I had to stay out of work for 2 weeks, and I'm going to have to miss 6 more weeks, future lost income. Impairment of earning capacity, probably not from an appendectomy due to appendicitis. Pain and suffering, sure, let's throw that in. And my wife, who'd probably like the vacation from me being in the hospital, but I encourage her to sue for loss. Right? She doesn't have the husband she would have had if Dr. Vinny Bombatz wasn't so careless. Do I have a case against Dr. Vinny Bombatz? Raise your hands, not that I can see them. Who says yes? Who says no? The no's win. Why? In that fact pattern that I gave you, let's say Dr. Vinny Bombatz did the job well, and I didn't have to actually see the other doctor. I would have had the same medical costs, the same future medical care, lost income, pain and suffering. So his negligent care, I'm not going to call it malpractice because we have to get all 4 elements. His negligent care actually didn't put me in any worse of a situation that I would have been in had he practiced properly. So the reason I say this is you need to fulfill all 4 elements before you can say there's negligence, before you can say that there's malpractice. Now, let's say I didn't see another doctor for 2 days, my appendix burst, I was in the ICU, so on and so forth. In that case, yes, I'd have a malpractice suit, because what's the difference between the outcome that I actually had, which was not a good one, versus where I would have been if Dr. Vinny Bombatz had practiced using due care or practiced in a non-careless fashion. Then there is a difference. The fact pattern that I gave you, no harm, no foul, because except for 10-minute delay or whatever it was, I actually wound up physically, economically in the exact same place I would have been if he was not careless. And that's it for me. I think we're going to close this up. Hopefully it all took, and I will see you online.